It is just a huge honor for me today to be podcast interviewing Dr. Lawrence Neville. He's been treating patients successfully for over 12 years. He has clinically performed over 30,000 hours of treatment. He performs over 100 hours of CE per year to keep up to date with the latest techniques and technology. He is so obsessed with learning, he now runs his own dental seminars company, Dental Events Australia, to teach other dentists some of the latest techniques. He's a speaker and coordinator for the IAS Academy. Is that the IASortho.com Academy?
Right, yeah.
His area of interest is cosmetic dentistry. This includes teeth straightening orthodontics using Invisalign, invisible clear aligners, and digital smile design. He treats over 100 cases per year in this field, and with Invisalign, he is passionate about changing and creating perfect smiles that are life-changing. He is also passionate about rehabilitation with fixed tooth replacements using dental implants. Other interests include sleep apnea, anti-snoring devices, and early child development, Myobrace and Palatal Expansion. Being a nervous patient as a child, Dr. Neville spends a lot of time with extremely anxious and phobic dental patients, helping to make that first step into the practice by arranging Skype calls or coffee appointments as a first visit to break down some of the fear barriers that many prevent patients taking them that step into the practice. Dr. Neville has completed a one-year implant master clinician program with the Guide Institute in Los Angeles. Outside of work, he is still competitive on the football soccer field and still trying to lower his golf handicap. He loves music and traveling. You know, you were born and raised in Scotland, right?
Born and raised in Scotland.
And
yes.
It was a man in Scotland who, it's so fun to go international because people don't realize there's 2 million dentists in a herd of 8 billion sapiens. And it was a Scottish dentist who told me, so, well, Americans don't treat phobic and scared and anxiety. I go, well, yeah, we do. We offer drugs or nitrous, and he goes, yeah, that's not treating it. If someone's afraid of a dog, you don't just put them to sleep. You can get in there and do their root canal, but when they wake up, they're still scared of a dog. And he was the first one that peeled my mind open that, the way to treat anxiety is establishing a relationship based on trust and communication and the rules of engagement. You raise your hand, I'll stop. And the Scottish people are really leaders in this field. Did you, was that your perception too?
Yeah. I mean, I suppose I was very lucky when I was at university. I don't know if we're going to talk about the same person here, but I was lucky enough to have a lecture from a Scottish dentist called Dr. Mike Gow.
That's the one I'm talking about.
You go, yeah. So again, he was very influential in the university, and his lecture was very outside of the box. The way he established relationships with patients and the way he overcame anxiety, in some cases without even using any drugs, any gas, any local anaesthetic, even in certain cases.
Yeah, his name's Michael A. Gow, and he's got about 400 letters after his name. He has the Berkeley Clinic in Glasgow. And I went up there and with 3 of my 4 boys, and just what an amazing man. But a lot of those buzzwords he says, like hypnosis. I know all the. I know my homies in America. A lot of them think, oh, that's crazy and all that stuff like that, or holistic medicine or whatever. But my gosh, you're a dentist. You think it's endodontic therapy. The patients think it's a root canal to cause pain. And when people put on their websites alternative dentistry, holistic dentistry, hypnosis, all these buzzwords, they get people driving 5 hours to go to their office. I know a guy in San Francisco, and his whole website's about how green he is, and all of his offices ran by solar, and he's not leaving a carbon footprint. And what's hilarious, he has people driving in a car an hour and a half, burning all this fuel and causing all this pollution to go to his office. It's off the grid. So I don't care if you believe in being off the grid or on the grid or hypnosis or not. It's a great way to start a relationship with a bunch of people that want to talk to you about their dental concerns.
Yeah, definitely. And we find that the same thing happens. So we certainly offer Skype consultations. We do 10 to 15 minutes just for them to see that we're a normal person, everyday person, just exactly the same as them. We offer people, we've got a coffee shop downstairs. We offer people, instead of waiting in our waiting room, to wait in the coffee shop downstairs. As soon as we're ready, we'll call them. There's no waiting about in the dental practice building up that anxiety. Instead, they're in a normal environment beforehand. We offer them to send us a selfie beforehand, because a lot of people are self-conscious about the way they look in their smile and judgment from us. And all these things are just small things that open the door to patients that come into our practice that wouldn't otherwise come in.
I thought, you being from Scotland and Australia, I thought you guys were all tea drinkers. I thought the British were into tea.
They are. Well, that's another part of being British. We're famous for not having great teeth, and unfortunately, especially in the west of Scotland where I grew up, we've got a famous drink called Iron Brew, and it's known for having loads and loads of sugar and causing massive decay in kids, which is where their anxiety and fear comes from, because they go to the dentist as a young kid and need a lot of dental treatment rather than having the preventative care that, luckily, I think in North America is far better. And I see, certainly from my patients' mouths in Australia, I'm lucky that I see patients from all around the world, from Southeast Asia, from North America, from Europe. And my North American patients are the ones that love coming to the dentist because they've had good education when they've been young on how to look after their teeth.
So you're a speaker and a coordinator for the IAS Academy on iasortho.com. Tell us about your journey about making you want to go to the IAS Academy.
Yeah, so certainly the IAS Academy's been very well known in the UK, and it's expanded across into Europe, and is now a big leader in education in Europe. They've got a really, really, really good top speaker in Dr. Teeth Qureshi, who's very, very conservative in his treatment, and he basically has pioneered a line bleaching bond and really taken it to another level. He's been quite aggressive and been critical on a lot of dentists who place too many crowns, bridges, veneers, and he thinks that a lot of tooth wear can be restored and can be fixed by getting the teeth in the right position and doing some conservative edge bonding. And he's got great cases that he can sort of show that have lasted 10, 20 years and really save patients' teeth and save their oral health. So it's, just their philosophy is fantastic. I think it's a really good philosophy.
Yeah, Tiff Kershey, I did a podcast with him. I mean, amazing. What do you think of the IAS Academy? How has it worked for you? What are your thoughts on it?
Yeah, so I came across Dr. Teeth Qureshi and went to one of his lectures when I was in the UK before I moved to Australia, and I always really liked his philosophy of being able to treat lots of different cases of wear and to early intervene into patients by doing some simple orthodontic treatment and some simple composite edge bonding, and he manages to get patients really long-lasting smiles and improves their oral health over a long period of time. I love the fact that he had cases for 10, 20 years of his own cases that he well documented. And then I also love the fact that the IAS Academy weren't really pushing any one system or one product upon you. They're really good just philosophy of treatment, and that's what really they go around the world now teaching.
So do you, I mean, in business, you're supposed to create a supply of what people are demanding. And so is this when you got out of dental school, how high up was ortho as compared to, implants or sleep apnea or same day crowns with chairside milling or lasers? How did you gauge? You're in Sydney, Australia. What was that your top priority? Was it a second, third? What was the...
Yeah, I think ortho was always the interest that I had in dental school, and I was always very, very close to going back to studying to become a specialist orthodontist. And then the more and more I learned about it, the more interest I got in it. And I was very lucky when I arrived in Sydney, Australia. I managed to work for a specialist orthodontist for about 4 years in his clinic, and from there my interest just spiraled really, and I suppose I've been quite lucky that I've had good mentors and good training academies, and I sort of realised that I can do a lot of the orthodontic work but still have fun doing all of the restorative stuff that I do and changing people's smiles, without going back to dental school and becoming a specialist orthodontist. It also meant that if there's any really difficult cases, I still managed to pass them off to the specialists who they should go to, which suits me.
Man, that IAS Ortho talk about the Orthodontic Hall of Fame. You got Tiff Qureshi, Yeah, Ross Hobson, Pravesh Solanki, Anoop Mani. I mean, that is a hell of a team of people that you're associated with. I mean, those are all legends on there. So what would you say to a kid? So it's May 6th here. I know it's May 7th there. You Australians are at least a day ahead of us on everything and several years ahead of us on most things. I'll give you an example. Elon Musk started this new tunnel boring company. And when people start talking about it, he's like, what is he thinking? It's like, dude, I saw this in Sydney decades ago. I mean, we always have to tear down houses. Like right now in Arizona, they're expanding this interstate and they had to tear down actually like 8 miles of houses. It's like, dude, the Australians, they just tunnel under. Why are you tearing down houses? I just think it's, seriously, my brother Paul lives in Sydney. It's the only city that every time I go there, I always wonder why I'm coming back. And it's only because I got 4 kids and 5 grandkids. But if I was like an orphan with no children or whatever, I'd be living in Sydney with you. But when you're opening up your practice in Sydney and it's May 6th, and we're going to have a whole fresh class of dental graduates this Friday night, 6,000 Americans are going to graduate from dental school. What would you say if they were saying, well, I got to pay out my student loans? Which do you think there's a bigger demand for? Implants or ortho or, put them top to bottom of how you would do that?
Yeah, I think for me in Sydney, where we're situated, I opened up my clinic in the city centre of Sydney, and generally people in Australia are very much into their health and they look after themselves. They go to the gym. It's an outdoor lifestyle. Everyone's in board shorts and bikinis, and people are keeping their teeth in Australia. People are not losing as many teeth as they used to. So for me, it's all about orthodontics. It's all about cosmetics. It's all about making people look good. If I was a graduate nowadays, I don't think you can practice dentistry without knowing some sort of orthodontics. You don't have to be the best orthodontist in the world, but you have to be able to get teeth into a reasonably good position to keep teeth healthy over a long period of time. It improves people's brushing, improves people's cleaning, the patients are motivated by it. For me, it's orthodontics. I think there's always going to be a place for implants. People are always going to lose teeth, but for me, in the city centre of Sydney, where people are healthy, people are wanting to look good, it's orthodontics and cosmetics.
So would orthodontics, you think, be the highest demanded item? You think that's number one?
I don't think I'm wrong in saying that Invisalign in Australia as a product is probably one of their strongest markets. They grew here exponentially overnight, and they grew here very easily. I know compared to the UK, I think Invisalign is much bigger in Australia than it is in the UK. But I think orthodontics across the board in Australia, dentists were conservative in getting into either cosmetic orthodontics or short-term orthodontics. I think now, really, in the last sort of 4 or 5 years, it's very much taken its place in Australia.
So you do over 100 Invisalign cases a year. Is that correct?
Yeah, so Howard, I started my practice in Sydney 18 months ago, and in the first 12 months, we managed to hit over 100 Invisalign cases.
So how did you go into Sydney? It has a dentist on every corner. I mean, so I got to tell you my journey about Sydney. What year did you get from Scotland to Sydney?
I've been here since 2010 or 2011, about 7 years.
Okay, 2010. I started lecturing down there in 1990 for Port Laboratory. They bring me down, and it was a 16-hour flight from LA to, I'd go to Auckland, New Zealand, Sydney, Melbourne, Perth, Adelaide, Gold Coast. I do the city every other day, and I did that about every 5 years for many, many years. And when I first started going down there, I mean, they had a severe shortage of dentists. And then there was a couple of government reactions to that severe shortage, and they let in like 1,000 licensed dentists from probably like you and all these countries. Plus, they opened up a bunch of schools, and now it's very competitive. So in my 30 years, Sydney went from anybody could be booked up a month advance to now it's really difficult. So how did you just open up a practice in that crowded market in Sydney and do 100 Invisalign cases?
So I think firstly I was lucky. I was very lucky to come across at a time where dentists were in demand in Australia. So I managed to sneak in to this wonderful country and this amazing city. But secondly, I think that I came from the UK where it was already competitive, and I knew how hard it was to market and to advertise and to get new patients. So I think I looked at the UK and I looked at the US where markets were already saturated, and I thought, what are dentists doing? One massive thing that we've done with the practice, which has helped hugely, is again, in about a year and a half, we've managed to collate about 130 Google reviews. And the Google reviews have just brought patients' confidence up whenever they make a booking with us. That certainly seems to be something that really helps. And then the other thing we've done is just create a world-class experience when people come to the practice. We base ourselves around a 5-star hotel. I constantly, when I go to restaurants, when I go to hotels, I look at what's good and what's bad. I'm always judging customer service. I'm always judging the smell of a place, the look of a place. So we've just tried to build on being a 5-star dental practice, and every day we walk in, we do a walk around the practice and we see what's good and what's bad and what we can improve on, and we're just constantly striving to get better and better. So I think we've really hit every area of marketing and advertising. Some of it's cost us a lot of money, some of it's been completely free stuff like Google reviews, and we now have the ball rolling that our referral system is just huge because people have hopefully a great experience every time they come.
So it sounds like Google reviews was a big part of this. I mean, was that the biggest part? Google reviews?
Yes. I think Google reviews has been a huge part. So we always ask patients, why did they book with us? Why did they choose us? Who referred them? And generally our booking rate is through Google reviews that they've read after searching for a dentist in Sydney, or they've been referred by a patient of the practice already. So every patient that leaves our practice gets handed some business cards, gets asked if they've had a good experience, and if they say yes, we always ask them to refer their family and friends so that we can look after them in just the same way.
Okay, well, Friday, 56 dental schools in the United States are going to graduate their class, and their moms and dads are going to be crying and all this like that. But if she listens to this podcast on Monday morning, she's going to say, dude, I just walked out of dental school. I didn't learn how to do one Invisalign case. And now I didn't do one in dental school. If she said to you, I want to learn Invisalign, what would you recommend that she do?
I would recommend that she does as many courses as possible. So find a reputable company that's not pushing a product on you, but is pushing more a philosophy, and go around and educate yourself as much as possible. Find your nearest friendly orthodontist and hang out with them as much as possible. Learn as much from you as possible. If they're a good orthodontist and they're forward thinking, they're going to teach you just as much as anyone else would, and out the back of that they'll get lots of referrals from you of the cases that you can't do, and hopefully you'll start to be able to dip your toes in the water. Again, start really simple, don't push yourself too much, but yeah, it's something that all dentists are going to need to know in the next 5 years, 10 years.
And in your orthodontic training, where you're a lecturer for speaker and a coordinator for the IAS Academy at IAS Orthodontic, a lot of the ortho people are now starting to also, besides Invisalign, starting to get interested in sleep apnea, snoring, early childhood development, Myobrace, palatal expansion. Do you see that as a big factor in the orthodontic training, or do you think sleep and snoring and all that stuff is really a separate genre?
Yeah, no, I think so. I think it is a factor nowadays. And again, I've been lucky that there's a couple of really, really good forward-thinking orthodontists in Australia who definitely with early child development try to prevent all these issues that adults may or may not come across when they're a little bit older. And I've got a real passion for when kids are 9 or 10, assessing them properly before they get to the age of 13 or 14, where it's a little bit harder, and it's much easier at 9 or 10 to put on just a partial sort of braces or banding, get nice expansion of the palate, and hopefully that encourages proper nose breathing rather than mouth breathing. And I think that's a big factor in going forward as a growing child and as a growing adolescent. So yeah, I think that's definitely a big factor.
What percent of the orthodontists do you think in Sydney would love to help a young kid learn how to do Invisalign, thinking in abundance? And what percent do you think would say, no, that's what I do. You want to do Invisalign? Send them to me. What do you think the breakdown would be?
It's That's a tough question. It's a really good question, Howard, and you put me on the spot here. But I think it's about 50-50, to be honest. There's dentists in Australia, I think, are still quite conservative in what they do compared to the rest of the world, which I don't think is not a bad thing. And I think the orthodontic community in Australia is definitely changing, but they still have a lot of conferences and a lot of education, which is orthodontists only, and they don't allow anyone else into that education. And I think the ones that are forward thinking are the ones that the practices are growing, because they're getting more referrals, because they're helping dentists rather than hindering them, and they're helping the profession rather than hindering the profession.
I only got kicked out of one seminar for getting busted. It was a specialty convention. It was endodontics. And he found out halfway through, someone ratted me out or called me or whatever, but he found out. But whenever they would come, and it was like especially only, you just sign up. I mean, dentists are all introvert shy. They're all scientific engineer type people, mathematicians. And all you do is you just go in there and don't make eye contact and sit in the back by the wall. And I've done that so many times. I only got busted once. And I was sitting there with Mike Detola. That was the problem. You don't ever go to an incognito seminar with Mike Detola. We were back there laughing and cutting jokes, whatever. But yeah, I think it's bizarre how the endodontists all want to help you learn endo. The oral surgeons all want to teach you extractions, but some specialists don't want to teach you. That Myobrace and Palatal Expansion, is that controversial in conservative Sydney? Because United States is like Sydney in the fact that, there's no such thing as United States of America. Every time I'm traveling abroad and I meet a dentist that says, "Oh, I went to America," I always wonder, like, okay, well, how, what did you do? And they always went to the Greater New York meeting in Manhattan and never left Manhattan. They flew into LaGuardia or JFK, and I thought, my God, if you think New York City is United States of America, you haven't even seen it yet. That's like, when I think of Australia, half the population lives in Melbourne, which I think it was conservative. The other half's in Sydney, more progressive. And then the other half lives out in the rural, and the rural half of Australia is extremely conservative. And so does something like palatal expansion, Myobrace, all these things, is that accepted or is it considered controversial?
I think that it's a little bit like Invisalign was at the start, that patients are becoming more and more aware of it, and it's almost been driven by patients that are saying, listen, we've heard about these treatments, we want you to tell us about these treatments, and we want your opinion on it. I think Myobrace still is quite controversial. I think palatal expansion is becoming more and more the norm nowadays in most cases. But yeah, there's still a bit of a scepticism over Myobrace. There's still a bit of a scepticism over the teaching. I'm a member of a lot of Facebook groups, and there's still big arguments going on Facebook when people are behind the keyboard typing towards each other. Some of them, I don't know if they would say face-to-face, but certainly they do it over the internet. And I think that there's a place for it. I really do. I don't think that it's for everyone. I don't think it's across the board blanket. You can do it in every case. It's case by case. But I think there's a place for it. I've got certainly Myobrace. When I first dipped my toes into Myobrace, I was a skeptic. I thought, this is a load of rubbish. How can a piece of plastic that you're going to stick in someone's mouth that has no shape to it really can work? But the concept works when you get the breathing right, when you get the tongue in the right position, when you work the muscles and you use the device properly, it works. But again, the hard thing about Myobrace is compliance. You've got to be checking your patients regularly, you've got to be on top of them, you've got to have good parents that are going to look after the kids when they're doing it. But I think it's a great device used in the appropriate manner.
For all the kids listening to this that have no idea what Myobrace is, and by the way, it's Myobrace, Myobrace, and if you go to Dental Town, oh my God, the threads on this are crazy. They're just, do a search for Myobrace. Every thread that comes up is a huge debate. So explain what it is and what you think about it. What is it?
Yeah, so it's a two-part system. You have a couple of small devices which you put in a patient's mouth, much like a plastic mouth guard. They're not custom made. There's 3 different sizes of them, and you work through the 3 different sizes of Myobrace. But alongside getting the patient to wear it at night time and a couple of hours during the day, so you're looking for about 12 hours per day wear. you also get them to do some myofunctional exercises, which involve tongue position, which involve stretching the lips, which involve breathing through the nose. And you basically work through a program with the kids. Normally, I work through the program for about 12 months. At the ages of round about 8 to 10. I find any earlier is very hard to have compliance for the kid, and I find any later you've kind of missed the boat a little bit. So around about 8 to 10, and it just helps to create a lot of space in the mouth, and it helps to position the teeth into the correct positions.
And what is really the difference between myoface.com and Chris Farrell down in Australia with myoresearch.com? Are those guys connected?
I think they were connected, but they've maybe separated or split apart. Actually, I don't know the answer to that, Howard, to be honest.
Okay. But yeah, I've had board certified orthodontists come on this show and just not like anything about it, and but it is definitely taken off. So go ahead.
I was going to say, the great thing about it for me, Howard, is that it's the perfect treatment to do no harm. Because if you try it and it doesn't work, you've not done any harm. You put it in, it's just exercises, it's just a mouth guard. It's the safest way to almost dip your toes into orthodontics, because you can literally do no harm if you're doing it as an early intervention, 8 to 10. Your fallback, if it doesn't work or if they're not compliant, is that you stick in a palatal expander and you put on some braces. And I think it's a gentle way to introduce kids into orthodontics, and I think it's a thing that you can really, as a dentist, most of the stuff we do, if we get it wrong, we cause harm, we cause iatrogenic damage, where with Myobrace, you really don't. There's no downside to it, really.
So is the CEO of that Rohan Wajit?
Yeah, so Rohan's one of the speakers, and he's quite prominent with the Myobrace, and again, he's very passionate about it, so he'll have some long debates. I'm sure he's probably been on Dental Town and other forums having some massive debates.
So these kids coming out of school with all this student loan debt, after you're recommending they get into ortho, there's a big demand for that. It's a great service. What would be next? Would it be what would be the next, you think, highest return on investment to get to know more of?
Yeah, I mean, I think first and foremost, maybe 3 to 5 years out, treatment planning. You've just got to be good at treatment planning. If you can treatment plan well, then you'll always be safe in dentistry. You'll always do really well. So again, great mentors to help you treatment plan. And then the other investment I would make, which I did as soon as I got out of dental school, was do non-clinical. So don't even think about a treatment, just think about communication. And I was lucky to have a couple of good speakers that I seen early in my career, Ashley Latter and Chris Barrow, who now come out to Australia and speak for me. And they all talk about patient experience and communication. If you can't communicate, if you can't sell a treatment to a patient, if you can't explain why a patient needs a treatment, or you can't evoke what a patient wants, then you'll never use any of the clinical skills that you've learned. So my next investment as a new grad or a young dentist would be communication. Get really good at it.
I've had so many dental consultants. We all say this, we all laugh, but I think everybody thinks we're joking, that if some guy opens up a new practice and say he goes in there and works Monday through Thursday, 8 to 5, the typical dentist, maybe a half day Friday, and they say, well, of course should I learn? We always say, well, you know what you should do? You should get a job Friday night is either a waiter or a bartender. And if you're really, really bad, maybe you should be a bartender, because maybe you can start with talking to drunk people, and but just anything, because you could go learn the Toastmasters Club. You could I mean, there's all the art centers have all these different what do they call that when you improv. So they'll get 4 or 5 people. I had so much fun in improv classes. There'll be like 4 or 5 people, and they just tell you the role, and then you got to go. Comedy school, anything to learn how to look someone in the eye, because deep down inside they don't want to be the 1 in 5 Americans who have no teeth at 74. They're embarrassed of their smile. They're in pain. That they're going to spend all their money on cars, houses, and trips and vacations. And if you really think about it, I mean, a good dentist would really want you to get those 4 cavities fixed. And they just, they just got to learn how to talk to people. Were you a natural at talking to people, or is this a journey for you?
I think it's funny because I think if you speak to most dentists and you say, come on this communication course, or I've got a great communication course for you where you're going to learn how to talk to people, how to get people to talk about their emotions, how to have patients asking you about the treatment rather than you selling the treatment to them. Most dentists would probably say that they're above average, and I would be in that case where at the start I thought I was above average. I could talk on a night out, I could talk on the sports field, I could give talks to my teammates. I thought I talked quite well to my staff members. Until you go on some of these communication courses, you realise how poor you are at talking to patients, and how poor you are at talking to patients about certain treatments, because we're just all taught in dental school to use dental jargon. We don't use normal everyday language that patients need to learn. And I think over 4 or 5 years of watching speakers come out to Australia with communication courses for my company, Dental Events Australia, I actually realise how bad dentists are at talking to patients. And it's funny to see them on the course. After you're about 4 or 5 hours into the course, all the dentists that are there and maybe sceptical that they even have come in the course start to laugh about 4 or 5 hours in, because they realise, shit, I've been doing this really, really poorly for the last 5-10 years of my career, and most of them finish the course saying, I wish I'd done this course 5 years ago. So the ones that are new grads that are coming on the course, the first thing I say to them is congratulations before we even start the course.
So now you actually have courses. You have the Dental Events Australia. Are you talking about your website is dentaleventsaustralia.com.au? Are you talking about the courses you're putting on?
Yeah, so dentaleventsaustralia.com.au came about when I first arrived in Sydney. We got a good group of young dentists together to do a study club, and from that they sort of demanded that we had more and more education, and basically I was looking around Australia, and at that point in time, about 7 years ago, there were certain speakers around the world that I knew just were not coming to Australia. So from that, it kind of spiraled by accident through the demand of the study club. I decided, right, I'm going to bring my first speaker to Australia and I'm going to see if I can make it work. Luckily, the first speaker was Ashley Latter, who I knew really, really well from the UK. Great communication coach, really start to finish of a consultation. I don't think there's anyone that does it better than him in teaching dentists how to do it. And we brought him out, that would be 5 years ago now, and it was really successful. It took off. We had over 50 dentists went through the course in the first year, and every year since we've been bringing them back. We're now at a stage with Dental Events Australia where we bring out about 10 speakers a year, and we run 10 courses from February right through to November, and then we have a bit of a break through December and January, which is summer over here.
Wow. So now, is that your company? Dentaleventsaustralia.com.au is your company. Has that been a journey? Has that been hard? Some of the meetings in the United States are competitive, and you used to be low-hanging fruit to have a big meeting 20, 30 years ago, but now it's more competitive. How has your Dental Events Australia been doing?
Yeah, I think it is very, very competitive. And we're lucky enough over the last 5 years, every time we've run an event, we've managed to have enough numbers to run the event. I'm very conscious that I'm a dentist and I've been to a lot of continuing education, and it's not even so much the money you pay for it, but it's giving your time up and giving the time out of clinics that I always, again, want to deliver a really good experience for the dentists that come on the courses. And I want them to get value out of the courses. I want them to get something they can really go back into practice on the Monday and implement quite easily. So over the last 5 years, we've been very lucky that we've managed to run the seminars successfully, but I think it is getting harder and harder. There's a lot more continuing education online. There's a lot more young dentists that want to do their education online in their own time whenever they want to do it. Ours is very much a hands-on seminars. Ours is very much face-to-face seminars, not got anything really online. That might be the next stage. I think I'm a bit more traditional, even though I'm young. I like to go to face-to-face education. I like to interact with my peers. So that's kind of our philosophy with the education. Just pick the best speakers from around the world and do 2 to 3 day seminars face-to-face where they can get really good hands-on practice, role play, whatever it may be.
So your courses are usually 2 to 3 days. So what is that, a Thursday, Friday, Saturday, or Friday, Saturday, Sunday?
Usually Friday, Saturday, Sunday.
Wow, that's a big commitment of time to leave work
Yeah.
Thursday and commit to the whole Friday, Saturday, Sunday. Are they always done in Sydney?
Yeah, we've moved them around a little bit. Most of them are done in Sydney, but we run a good few courses in Melbourne, some in Brisbane. We've done one course over in Perth, which seems to be a little bit harder. Again, more out the way, more remote, less dentists. So the main attraction seems to be that dentists quite like to come to Sydney or Melbourne for the weekend and sort of make a bit of a weekend of it, do some education, see the city.
So when you're throwing a successful meeting, what do you think the most successful topics are? Is it what do you say? You talked about treatment plan, communication. What do you think the hottest topics are?
Certainly, the one that we sell out every single year is Ashley Latta with his patient communication. So ethical sales and communication certainly seems to be a hot topic. He's got quite a good reputation now in Australia. We've had great feedback over the years, so it's really, really good. We're starting to bring Chris Barrow out to Australia a little bit more, and he's on overall sort of practice growth and development. So again, more on the financial side of things, more on the patient experience side of things, some running your KPIs and your numbers as well, marketing and advertising. But then we've got some great hands-on courses with IS Academy on orthodontics. We've got a periodontal specialist coming out at the end of the year to teach some grafting techniques across the board. But yeah, I think the hot topics are on the stuff that you're not learning in dental school.
So it sounds like when you say treatment plan, communication, Ashley Latter, ethical sales, the communication, Chris Barrow. So you're saying the hottest would be practice management, and
Yeah, I
then
think
the
so.
second you said was ortho. So I'm
Yep.
trying to manage this so the kids can think about supply and demand of of a skill they're learning. Does it apply? So practice management was number one. You got student loans, you got to pay it back. Then you mentioned ortho, and Invisalign is just huge. And then after that, you mentioned periodontist, which now we've entered the implant zone.
Yeah.
And so how so what's more what do dentists in the city want to learn more about? Do you think if you ask them ortho or implants, what do you think they think is the better thing to learn?
I think in Australia at the moment it's ortho, which is the biggest topic.
Because there's
a
no
lot of
blood. There's no
orthodontics.
blood and guts. It's Invisalign, bleaching, bonding, veneer. To me, Invisalign, bleaching, bonding, those spa treatments, Botox, all that stuff. It's more of a person that's not more the blood and guts. It seems like it's like even in a little root canal. I mean, some guys like me have to file it all the way out and get a sealer to blow out the apex because we're apical barbarians, and then the next person's timid and shy and wants to stop a 0.5 millimeter from the apex and get a working stop. I just think that you could divide up dentists in half. Half love blood and guts. They love root canals, implants, surgeries, apical. I mean, hell, if I broke up a file, if I couldn't get it out, I mean, I'd do surgery. I'd do an apicoectomy and push it out the other end. So I guess a lot of it depends on just your preference. Do you like blood and guts? Go to implants, go to root canals, do bone grafting. If you're not really into blood and guts and you like pretty sweet, soft stuff, Invisalign, bleaching, bonding, veneers. Is that how you see it, or do you see it differently?
Yeah, no, I do agree with that. I think that people go down certain paths, and certainly the ones that do ortho, align, bleach, bond, certainly do less of the other stuff. And I think that the ortho, align, bleach, bond is it's patient driven, it's patient demanded as well. I think it's difficult to have a patient come in and ask for an implant. They don't do it until it's a little bit too late. Where I think patients come into practices, certainly in Sydney, demanding cosmetics.
And so after practice management, after orthodontics, we're into implants now. What do you, you talked about the importance, and I agree that it should be taught by someone who's not selling something. When sleep medicine got taken off the started to take off the United States, you couldn't go to any of the courses because you could tell the only thing they cared about is that you were going to buy some $5,000 machine and all. It was a machine sales course. But unfortunately, most of the implant training is sponsored by the implant manufacturers. So how do you, you said specifically, learn from people that aren't selling you a bunch of product. So how do you learn implants if 80% of all the courses are put on by the implant manufacturer?
Yeah, it's difficult, and I think that's the hard part, and that's what drove me to start my own education company, because I didn't want to go to seminars that were just selling you a certain product or a certain item and not teaching you the right fundamentals and the right philosophies. Most of our education programs don't have any sponsorship to it. Only occasionally we do take sponsorship to it, but we make sure that the sponsors get a good experience, but they're not pushing a product on anyone, and our speakers aren't pushing a product on anyone. And that's what I've loved about the IS Academy. They're now completely open source, not selling a product. So with regards to implants, I think I was lucky enough to be recommended to do the Guide Academy, which is certainly is associated with Noble Biocare, but they certainly don't push Noble Biocare on you. They're mostly in the background, and again, it's just great teachers, it's great dentists, it's great specialists who want to teach dentists the right philosophy and want to teach dentists to be safe and perform fantastic treatments.
So you flew all the way to Los Angeles for that Guide Institute. I have flown that. That's a long flight. Do you agree or disagree?
I agree.
Oh my gosh! So what's your strategy on a 16-hour flight from Sydney, Australia to Los Angeles? What do you try to do?
Yeah, well, I'm Scottish, so I do like to have a drink.
You're Scottish, you?
A couple of glasses of red wine before the flight, and I'm not bad. It's my only downtime. I never stop, Howard. I'm probably much like yourself in the fact that I'm always on the go. I struggle to sit still. I struggle to just relax and kick back. On a flight, the best thing was no phone, no technology. You're just there with a movie and a red wine, and you can just relax, enjoy yourself, catch up on sleep. The worst thing that's happened to me in the recent years is they put Wi-Fi onto all the flights now.
And do you buy the Wi-Fi?
I do sometimes, yeah.
I won't do it. I won't do it. So I started lecturing in '90, and I thought to myself, you can be rich, and when someone says, "Are you rich?" It's like, rich in what? I mean, the only true wealth is health. And I was talking to a patient one time. It was really sad because he was getting ready to leave to go to jail for like 3 years. And I said, when you're in jail, you'll be so rich in time. You won't be distracted by anything. And so when I when I started flying back to Australia, I thought, my God, it's a 16-hour flight. I had 4 kids out of practice, all this like that. I said, what textbook would you never, ever, ever have the time to read? I mean, is it Pathways to the Fall by Stephen Cohn? Is it Mitch's book? The first time I went there, I read Secrets of the Temple, an 800-page book on how the Federal Reserve works. That everybody told me, well, I mean, an 800-page book on Federal Reserve policy. I mean, you'd never read it. I started reading it on takeoff, and I finished it before we landed, and it was like the biggest mind trip I'd ever been on. So that's what I always do. I always try to think, okay, I'm going to be on this airplane. I'm rich and dying. Because some people are like, oh, I went to my doctor and got a sleeping pill, or they're going to sit there and get trashed and pass out. It's like, dude, you got 17 hours of uninterrupted time. And then I'm not a movie watcher, so sometimes I'll watch a movie or whatever, but that is amazing. So on that, now you call that it's the Guide Institute, small G, capital IDE. What does that small G stand for?
Well, you put me on the spot. I'm trying to think.
But is it still Dr. Shashka Janovich?
Yeah, so Sasha Jovanovic, Egon Yu from Europe. There's a couple other lecturers. Yeah, so in Australia it would be Dr. Chris Ho is certainly one of the prominent lecturers. Dr. David Dunn. They've got a great faculty. They've got in fact, their online portal is fantastic as well for watching videos and seeing procedures and learning about implants.
I have a friend in Maricopa, Arizona, right up the street from me, about 20 miles. And what he did, he was a young kid and out of school. He would just come home every night and get on YouTube and just put in dental implant surgery. And he just watched an hour of who knows whose YouTube video put up. and they saw a lot of Dentistry Uncensored popped up, a lot of courses popped up, and he basically became an implantologist by just watching YouTube an hour every night. But you flew 17 hours to the Guide Institute, and there's 25,000 dentists in California that live there and never been to it. Talk more about it. Why did you like the Guide Institute? And I mean, if you're going to fly 17 hours, talk to that guy who lives in LA who's never even been to it.
Yeah. I suppose the faculty, the names that they had on the faculty were sort of the rock stars of implantology, I would call them. So certainly that's something that always appealed to me, and appealed to me. Why are these guys so well known? Why have these guys done the cases? These are the guys that had really pushed the boat out early on in dental implants, I think, sort of when you're looking at 20, 30 years ago. And they're the guys that were still pushing the boat out today with really pushing through new techniques, being able to try out new things, but also being safe for the patient and getting good results. I thought that their online education is fantastic. I love travelling and flying around the world. I think LA is a fantastic city. It's a lot of fun. At the end of it, we went to Vegas afterwards, which is also a lot of fun. And they host a great conference in a nice hotel. They have tennis tournaments round about it. They have good dinners out, and you get to converse with some great dentists from all around the world as well. So I think a lot more than just the education goes round what you pick and do. And again, I encourage any young dentist, if you can afford it, travel all around the world and see a bit of the world while learning about dentistry. One of the most boring things to do, I think, is to stay in your own country and do continuing education. So I think if you can afford it once a year, pick a new country and go and learn some dentistry in that country.
And what I love about it is when you go to another country, you're not at the Holiday Inn and going on whatever, they cater to the deals. A dentist picks you up. In fact, whenever I go lecture in another country, they're always like, we're going to put you in this hotel. And I go, isn't there like one dentist that'll let me sleep in their house? And they go, well, sure, but why do you want to do that? I remember the first time I lectured in Poland. I stayed at Marcin Delecki's house. And I got up in the morning, and of course I love to eat, and I went to this refrigerator. I almost was stunned because I never even thought ahead of time what would a Polish refrigerator look like. It didn't look like anything I'd ever seen in the United States, the different foods. And I love the culture of it. And then the dentists, they all got the same people. They all got the same problems. They all got the same technology, but they all look at it slightly different. Like I was talking about in the beginning of the show, the hypnosis, where, that guy looked at Americans and said they don't even treat anxiety. They just knock them out and you wake up, you still got it. We actually treat it so that someday you don't have it. And I just love the way everybody's doing everything slightly different. So back to your practice at Spa Dental Sydney, CBD.
Yeah.
And what's the CBD stand for?
Central Business District. So in Australia, they call the city centre the Central Business District, the CBD.
Oh, the Central Business District. Okay.
Right in the financial hub.
And in your practice, how is that going?
Yeah, it's good. So we started the practice 18 months ago. It's myself and my business partner, who's also a dentist, Sean Parsonage. And it was obviously a big leap, and it was scary to start it. It was scary to go right into probably the place with the most dentists in the whole of Australia, right in the heart of Sydney. But it's where we wanted to be, and it's been a really good experience. It's been great fun. I love the business side of it. I love the patients that we have. And we've got a great team. I've been lucky enough to manage to employ some fantastic employees, some fantastic dentists, and it's just been growing month on month. We've had growth every single month since we started, so it's been amazing.
So you said the Guide Institute was sponsored, was sponsored by, did you say BioHorizon?
Noble Biocare.
Oh, Noble Biocare. So I'm just curious. So when you got done with the Guide Conference Institute, did you end up going with the Noble Biocare system? Is that the one you guys use today?
No, I didn't actually. Funnily enough, so I have actually mixed between Straumann and BioHorizon. Mainly we play Straumann, and the reason for Straumann is probably because Straumann are very strong in the UK because they have the ITI, which is their sort of training institute, and they do quite well actually. They're quite independent in the way that they sponsor it, but they let the clinicians run with the education and the topics that they want to run with. So most of the time we play Straumann implants in our practice.
Because you said Straumann has the training with the Straumann ITI Institute?
Yeah, the ITI Institute. So they're quite big in the UK. They're quite big in Australia. I'm not sure if they're in North America, if they've got the ITI as well.
Huh. So Straumann, so the international team for implantology, Straumann, the training education, so it's iti.org. And so you mostly learn implants on iti.org as a online, or are you flying to seminars?
Yeah, so they have online, they have seminars, and they have quite strong study clubs. So in Australia, they've got a study club in Sydney, and I'm sure they've got one in Melbourne as well.
So right now you're mostly placing Straumann.
Yes, yeah, mostly Straumann.
All right. So then continue. So you also talk about Invisalign assessment, and you're on the faculty there. You talk about digital smile design. Do you think the digital smile design is a big part of your success in implants and Invisalign?
Yeah. I think that we have the iTero scanner with Invisalign. Because we do so much Invisalign, we love having, well, I love digital technology. Again, being able to plan everything on your computer when you're in surgery or when you're not in surgery, I think is a fantastic tool. And to be able to see the end result before you start, I think is a fantastic tool. So all of our patients that enter the practice, whether they're coming in for cosmetic treatment or not, get scanned, and then we can really show them on the scanner what we can do. And again, with digital smile design, we can show them what we can do before we start, and it really motivates patients and it really gets them excited.
So a lot of people think that the iTero is an oral scanner owned by Align Technology, which owns Invisalign, to do ortho. But are you using the iTero scanner for non-ortho, like crown and bridge and implants and all the others?
Yeah, so we basically we have only for emergencies if the scanner ever is broken or is down, which never happens, and we have some impression material in the practice, but we're basically an impression-free practice. We hardly ever take an impression in our practice. Everything is scanned with the iTero, from implants to crown and bridge, to before ortho treatments, even for records. We do no charting. All our charting's done with the scanner. So it's a great tool. It's an amazing tool. Tooth wear, we check it with the Invisalign scanner with the iTero.
Do you agree of that perception in Sydney where most dentists, when they're looking at oral scanner, put iTero into Invisalign, and then they start thinking about BioLay or all the other ones with crown and bridge? Do you think that's a misconception, or do you not really see that?
Yeah, no, I think that they do probably do that, and I think that a lot of people go for other scanners because they believe iTero is an Invisalign only scanner, and it's maybe not as good at the restorative side of things. In a few months, I'm actually going to be speaking for Invisalign on their iTero scanner, and the thing that they've asked me to speak on is the restorative side of it, because we use it so much for restorative treatment, and I think that's what Align Technology has struggled with. They've struggled to get that message out to dentists that it's just as good for restorative as many of the other scanners, if not better.
Yeah, it's going to be a tough ride for them because they started in ortho, and of course, so they focus on the orthodontists because they do, so much of the ortho, and it got really branded as a oral scanner for Invisalign, owned by Align Technology that owns them, and it's actually a great scanner for everything else. What I like most about the scanning is how old are you?
I'm 32.
Okay, my son is 31, so I'm old enough to be your dad. What I like about scanning is that when you're 56 and you see your prep 40 times larger on the screen, the first time I see it, I think my license should be taken away and they should put me in jail and all that stuff. But the fastest way to quality is magnification. And if you see your prep 40 times larger, the endodontists are all using microscopes at 8x larger. Anybody at your age, you might even want just 2.5 loops, but when you're in your 50s, you'll want 3.8s, So magnification, every day you get older, you need more light and more magnification. And eventually you'll end up as isolate, because only an isolate can retract everything, flood it with light, and then you got your magnification. But when I talk to anybody who owns a crown and bridge lab, they say when the impressions come in on a scan, they have 1% remake, and when it comes in impression material, it's a 5% remake. And the quality is off the charts, because a lot of times dentists take an impression and that they can't even hardly see it. But man, when you take a scan, you never accept your first scan. You always take a scan and then, oh my God, give me a sandpaper disc and a round burr. You're in there trying to clean up. So I think a scan. I mean, when you get done preparing a molar for a crown, and you scan, what percent of the time after you look at it in a scan, think, oh, I got to go back and touch up something?
Yeah, I think I totally agree with you. I think that as soon as you see your scans on the screen, you're definitely thinking, God, I could have done that better, or there's a little bit there, or there's a little bit there, and you're always going to do a touch up. I think 75-80% of the time you're going to touch stuff up and try and improve on it, which is really good. And again, when we're talking about investments for young dentists in courses and continuing education, the best investment is a camera and a good set of loops, so you can see your work and you can criticize your work.
When you say a camera, what do you mean? You mean for what kind of camera? You mean an intraoral camera or a digital camera?
I think a digital camera. I think a good SLR digital camera. And if you can integrate that into your workflow where you're taking photos, you're scanning, and you've got a set of loops, then you'll do really high quality dentistry.
Well, I can't believe how many times you'll listen to people give an entire all-day seminar on marketing, and they don't even mention a camera. I mean, when you start building a culture, which starts from the head down, of getting a camera, taking pictures of your work, and then putting them on your website as your work, it's just amazing how powerful it is. I know several dentists that always take before and afters on their implant case. Remember, the patient doesn't want to see blood and sutures and all that. They want to see unhappy, sloppy before picture, and then she's all happy, smiley afterwards. And people are jumping in Southwest Airline planes and flying 2 hours because they want him to place the implants for work, because they've been going to their doctor in Fort Scott, Kansas for years, and he's a really nice guy, and they sit by him in church, but they've seen no evidence that would be the guy to do this big, expensive, complicated case. So they drive up to Kansas City because they were Googling dental implants. And so the guy, the dentist that gets a digital camera, which, by the way, when I got out of school, only millionaires can afford them, and now they're 10 times better for a tenth the cost. You start getting cameras and you start taking really cool before and afters. And with anything on a team, if it's not your cup of tea, that's why you have a team. Someone's a quarterback, someone's a wide receiver, someone's a blocker. And by the way, I don't know if you guys know this when you're listening to this, but did you guys know that the whole world thinks football is soccer, and in America we think football is the NFL. Did you guys know Australia has their own type of football? It's more like NFL football than soccer, but which is bigger, the Australian football or the Australian soccer?
Australian football.
Yeah, and it's totally. I am addicted to the NFL. I mean, the Arizona Cardinals. I'm the worst fan you could ever have. I mean, I don't. If there was a funeral during the game, I'd skip the funeral. But it's a really, really different game. I mean, the first time I saw the game, I didn't even get it. How do you like it?
I have to say so. I'm a massive soccer fan. I even calling it soccer feels a bit strange to me coming from the UK, because we just call it football. And obviously football or soccer in Europe is huge. I've tried to get into some of the Australian sports. I'm not quite there yet. They have a sport called Aussie rules, and that's their AFL, and it's more like a mix between sort of NFL and soccer, and it's quite good. It's a very scrappy game, but it's quite a good game to watch. And obviously they're massive with cricket, they're massive with their own type of football as well. So they're a big sports nation. They're very outdoors, they're very fit. A lot of athletes, they're good athletes.
Well, Australia, like I say, I've lectured in 50 countries, and my boys always say, "Dad, you've been saying that for 10 years. It's got to be more than that." I mean, last week was in Barbados, but bottom line is, Australia is hands down the greatest society. It's Sydney. I mean, it's hands down the greatest civilization on Earth. I don't know who in the world could think they're better than Sydney. I mean, it's just, I'm so jealous of my brother. But when you were talking about a camera loops and all that on digital smile design, talk about that more. And is that something you're doing with the iTero scanner or your digital camera? Explain to what you mean by digital smile design.
Yeah, so I suppose it's using both in combination. So anyone that comes into our practice, they go through a series of photos or a set of photos at the start before the consultation, and then usually we'll have one of our assistants or a hygienist or therapist. I'll scan the patient with an iTero scanner to get sort of the full records, and they'll have all their x-rays taken, and then we'll come in and we'll consult with them. So again, using the photos, using the scanner, we can quickly design stuff digitally in front of the patient, and again, if we run over time, we can get the patient back and we'll have designs of new smiles for the patients, and it just really excites them, it really motivates them. So it's something that we're doing more and more, and it's taken me really from sort of single unit dentistry into doing multiple unit dentistry and much more enjoyable stuff, much more exciting stuff, and multidisciplinary dentistry as well. We're doing ortho cases that are then finished with either composite bonding or veneers or whatever it may be.
So what software are you doing your digital smile design on?
So I've varied from PowerPoint software right through to using the DSD app and the DSD online website as well. I've varied from using technicians doing the designs for me to myself doing the designs. So I've sort of been in and out of a few different methods of doing it. At the moment, we're using more and more the DSD online stuff for us for the designs.
And that's our buddy from Brazil.
Yeah, Christian Coachman.
So talk more about that. Why you tried a bunch of different bunch of different digital smile designs. Why did you end with digitalsmiledesign.com, the Christian Coachman? What was it about that?
I think the ease of use, I think the way they present the plans in 2D and 3D is easy to excite the patient. It takes the work out of our clinic, where before that was taking up quite a lot of time. And then we can still always edit the designs that come back as well if we're not happy with them or we want to change them or anything like that as well.
And so what is the advantage? Because there's probably some guy listening right now who's been doing dentistry for 20 years and he thinks it's all cool. Why should he switch to digital smile design with Coachman?
So first and foremost, again, it comes back down to patient motivation. The patient comes to your practice because they want a beautiful smile, but they don't know what the end goal is really in their head, apart from that they want a beautiful smile that maybe a celebrity has that they can point out to you, and then they don't know the journey in between as well. And digital smile design helps you to show the patient the end goal. It helps you to show them the steps along the journey that they need to go through, and it also helps you with planning. So it means you can plan every step of the way. So the old term of plan it 2 or 3 times before you cut it is certainly part of digital smile design. So again, precision is part of the process as well.
So on your Dental Events Australia, when you go to that website, Dental Events, what you I see name, email, message, send. Where's the let's chat? Where's the upcoming courses?
So they should be on there.
Okay, Oh, I love that picture you have of the Sydney Harbor with the bridge. You got to climb over that. That's a fun climb. Man, what
Yeah, so if you scroll down, you'll see there's some courses on there. Our next course coming up is at the end of this month, and it's actually called, it runs through after talking about the cameras. It's called When the Pictures Really Matter. So there's a couple of great guys from South America. They're actually from Venezuela, and they've been massive in North America, teaching people how to take really, really cool dental photographs and how to market themselves on Facebook and Instagram, essentially, and how to build new clients and referrals.
So that's is that periodontal plastic surgery, Dr. Oliver Karka?
No, that's coming up towards the end of the year, so that's in November.
Oh, I see it. When the pictures really matter. That's a cool title. When the pictures really matter. And so tell us, when do the pictures really matter?
Yeah, so these guys are coming out 24th, 25th of May in Sydney, and they're coming out to Melbourne on the 26th and 27th of May. And photos nowadays are so important, so really great before and afters, really creative photographs. These guys are from Venezuela. They come from one of the hardest economic situations and countries in the world, and they've managed to get themselves to Madrid and to Miami, two fantastic cities that are really hard to be dentists in, and through photographs they've driven massive demand from dental companies to sponsor them. They've driven massive demand from patients to see them, and they realised that they had a niche in the market because not many dentists were doing it, and now they're teaching dentists around the world how to take great photographs, how to edit them, how to do video editing, how to create really cool marketing and advertising within your own practice at a budget cost because you're doing it all yourself.
So this is more. So you're saying when the pictures really matter is for marketing to attract more new patients.
Yeah, definitely. So they're teaching great photographs from a records point of view, and to show patients in your clinic. But then the upside of that is that when your patients have finished and they've left the clinic, they're using these photographs on Instagram, and they're huge on Instagram. Massive.
So will it be a one day? Is it a 1 day course, or is it one of those Wednesday, Friday, Saturday, Sunday courses?
Yeah, so this one's a 2-day course. So day one is really taking the photos, the philosophy, why the photos are important, how to take the right photographs, and then day two is more editing of the photographs, how to create videos out of your photographs, and how to motivate patients as well.
Okay, so we've talked about practice management, orthodontics, implants, the smile design. What other courses do you have coming up that you think they're hot, and why?
So the other one that you mentioned there was the periodontal plastic surgery. I think, again, that's quite a hot topic at the moment. We're seeing more and more patients keeping their teeth for longer, so recession's becoming a bigger problem and a bigger issue, along with tooth wear. We're also now seeing 30 to 40 years on implants that are starting to fail, and a lot of them are failing because there's not good gum tissue around about them. So I think it's becoming more and more important to be able to offer the patients a solution to that, and again, if you're doing really good implant surgery, to be able to add in the soft tissue.
Yeah, they're saying in 5 to 7 years, 20 to 40% of implants are ailing and failing. And that's another thing I want to talk about, because a lot of people get into implants because they think, well, I'm going to get a surgical guide and I won't even have to lay a flap and I'm just going to push this through a little hole. It's like, dude, yeah, that's if everything goes right. But the minute it goes south 20 to 40% of the time in 5 to 9 years, you need to be a surgeon. And it just scares me when these people, they want to become an implantologist without being a surgeon.
Yeah, I agree. I think that you've got to, again, I think it all comes back down to treatment planning, Howard. And I think you've got to really create treatment planning before you start any of these more complex areas of dentistry. And that's what it comes down to with your implants. You've got to treatment plan them really well, but then you've got to be able to back up the treatment planning by having really good surgical skills. And part of the surgical skills for implant placement is definitely that you've got to be able to be good with soft tissue, whether it's from just basic suturing all the way up to be able to do a soft tissue graft.
Well, the when you talked about seminars and you talked about, you want the seminar not to be trying to sell you something, the big money, the huge money, is not is trying to get you to buy $100,000 machine. They're having this course to get you to buy a CAD cam or a laser or something like that. We're talking about periodontal disease. There are lasers that cost $130,000 to treat periodontal disease. What do you think of the big technology purchases? And the reason I ask is because no one cares about a $20 or $50 trying of some bonding agent, but man, committing to $100,000, that's a big deal. What big tech? And then you're in the space of dental events, so you get tempted all the time, where they want you to have a course trying to sell a big machine. So what do you think of all these high price these technologies? Is worth the money or not worth the money?
Yeah, I think nowadays in dentistry, if you're a dental practice owner, or even an associate, you could be spending hundreds of thousands of dollars on education. You could spend hundreds of thousands of dollars on new equipment for your practice, and you've really got to do the numbers on your return on investment. Before we bought the scanner for the practice, we did the numbers on how much does impression materials cost us, how many remakes do we have to do, how many times do we have to redo an impression, how many times does impression material go out of date if you're not using it enough, compared to how many scans are we going to do, and the numbers work. Where with some of these bigger technologies and bigger investments, I don't think the numbers add up. When I look at people that do CEREC, I think, God, you've got to be doing a lot of crown and bridge work to make CEREC a good return on investment.
Yeah, but we have proof with CEREC of the fact that, it's been out for decades and it only has maybe a 10 or 12% market penetration in America. So 90% of the dentists said, I can live without that machine. You're saying oral scanners are a buy. I agree totally with that. What about these $100,000 lasers to treat gum disease?
Yeah, I don't know. I just don't. I think with how fast technology is moving, $100,000 for one of these lasers, I just don't think, for me, I can't see a return on investment in it. That's my honest opinion, but that's probably an opinion that I'm not an expert in the area. I'm sure there's many other people that will be better positioned than me to give an opinion on it. But for me, that's a massive investment.
Well, the smart people, the really, really smart people try to do everything faster, easier, higher quality, lower in cost, and make it more smaller and succinct. And a lot of times these dentists and our team members on a business, they always have this idea. And it's like, how come every time you have an idea, I have to go spend a ton of money? How come you never have an idea of where I can save money? And it's the same thing with your vendors and dealers. Like, man, if every time you have a good idea, I give you my money, let's just stop this relationship right now, and I'll try to find. That is just it's just so obvious.
Yeah, I agree.
So run through the technology again. Do you have a CBCT? You place implants?
Yeah, we don't actually, and I suppose that was, again, it's another investment when we were starting the practice, that we just thought they were priced a little bit high for the amount of implants we were doing in the practice to start with in the first sort of year or 18 months with what we projected. We went way above what we projected for doing with Invisalign, but with implants we've probably just been around about where our projections were. So for us, the return on investment in a CBCT to begin with in the practice wasn't quite there. We're now 18 months in and it's starting to become something that could be a good return on investment. The nice thing about Sydney, being right in the heart of the city, is that basically 2 streets down we have a radiology centre that we can send patients to and get the scans back on the same day to be able to talk to them about. So we've seen that as an advantage. Certainly if I was rural and I was placing implants, a CBCT might be more attractive, or it might be worth investing in technology. Again, I think it's the future. I think in the next 10 years every new dental practice will have a CBCT.
Yeah, and
I'm starting to notice that they're also coming down in price quite a lot. Even in the last 18 months since we opened, they've come down quite significantly in price as well.
Yeah, and the other thing is, the person that can teach you how to place implants the lowest cost is the periodontist or oral surgeon across the street. They've already got this machine, and so many of them are shy and humble and don't know how to talk. And when you go over there and tell them you want to be their friend and you want to learn and have a mutually rewarding relationship the rest of your life, they're all excited. And then the shy guy says, "Well, I'm not going to do that. I'm just going to go out and it's $100,000 CBCT. And the next time you talk to him, it's $100,000 CAD CAM. Then it's $100,000 to Latin labor, and it's always something. It's always something, and it's limited resources facing unlimited demands is what built the $80 trillion U.S. economy or the $80 trillion global economy today. Not that's the only way you could do it. So what about so you like oral scanners? You passed on, but you do. What about CAD CAM? Did you have a CAD CAM? Did you buy one?
We don't. We've got the oral scanner, and we're actually at the moment we're currently looking at some sort of in-house milling system, and we're also looking at a 3D printer at the moment as well. I'm quite interested to try and get into making some of my own aligners, and I'm certainly interested in doing some of our own milling in the practice as well. I think my practice philosophy is that 5 years' time we have our own mini dental lab as well.
Did you say you're going to start lecturing for iTero now?
Yeah, so hopefully before the end of the year we're going to do some webinars for iTero again to talk about their sort of restorative side of things, and hopefully educate the Australian dentists on why it's a great scanner for restorative as well.
So you are in Sydney, and now Invisalign has moved into Sydney, opening up their own stores right in your city. Have you seen those stores? Yep. And what do you think of it? And what are all the dentists in Sydney thinking?
It's been a great story. It's been I think it could be turned into almost like a mini series or a movie. The story of what's happened with Invisalign and Smile Direct Club in America. So Invisalign had to delay their store opening in Sydney, as far as I'm aware. Their store is 2 streets away from my practice, so literally just down the block from my practice. And they opened about 3 weeks ago, I believe. Since then, they've already sent us a few patients and a few referrals. So I'm a big believer in it for my practice. I think that it hopefully will boost our numbers of Invisalign patients. So we've been into the practice. We went on the opening day. On Wednesday night, they're throwing a big party. So hopefully I'll be able to eat and drink some of the money that I've paid them for some aligner bills over the years. It's very interesting, though, they're not allowed to scan patients in store because of the Smile Direct Club ruling in America, which they thought they weren't going to touch them in Australia, but apparently it's worldwide. They're not allowed to scan in their stores, which I find is very interesting. So I think that's been a big dent in what they wanted to do. And I think even in the first 3 weeks, their store probably hasn't quite hit off as much as they wanted it to. But it's massively to our advantage because we're just around the corner. So we're accepting essentially walk-in patients from the Invisalign store to our practice to scan them.
Wow, that is amazing. Yeah, that lawsuit, that was a wild one. And it's so bizarre because Smiles Direct Club has Invisalign make their trays, right?
Yeah.
And then so whenever you're so to me it looks like, okay, they're married and they're in court suing each other. This is not going to be pretty. You know. But interesting. But the one takeaway on the Invisalign shops and what people don't realize, if you don't want competition, then you shouldn't be able to live in the United States, Canada, Australia, or you should live in some underdeveloped country that didn't have competition and had crony capitalism and governments and all that stuff. So you live in this great society, the United States, Canada, Australia, New Zealand, and it's because of great competition. Everybody loves to live in a country with great competition, but they don't have to compete themselves. But the smart people, what I notice is that those Invisalign stores and those Smiles Direct Club, they're looking for the low-hanging fruit. They want class 1 molar, class 1 canine, 4 or 5 millimeter. They want the easy stuff. They don't want a class 2, a class 3. They don't want to take a Ceph and try to figure out what a 12-year-old kid's going to look like when they're 18. And so in my own backyard, when Smiles Direct Club opened 5 or 6 shops, all the orthodontists are up in arms But the really hopeful, neat ones, hell, they just wanted to go by and see it just because. I mean, it'd be like if you went to Sydney, you're going to see the Opera House. I mean, they're orthodontists. Like, well, who wouldn't want to see the newest thing in ortho? And then by pressing the flesh and being nice and shaking their hand, they found out that they turned down 80% of the cases because they're not technically within the parameters of what they want. They absolutely want class 1 molar, class 1 canine, adult, non-growing, easy, low-hanging fruit. So guess who they're sending all the difficult cases to? The guy that went over there running for mayor, hustling, pressing the flesh, going for it, thinking and hope, growth, and abundance. And on a Friday night, what do you want to do, honey? You want to go to a movie? You want to go to a restaurant? No, let's go see that new Smiles Direct Club. Isn't that cool? They're out of Nashville, Tennessee, and they're going to go public. I mean, life is an attitude, and with the right attitude, you'll be flying at a 40,000 feet altitude. And if you have a bad attitude, there's nothing anyone can do for you until you fix that. I can't believe, man, we're supposed to do an hour. We went over 20 minutes. Is there anything you wanted to talk about that I was too dumb to bring up?
I don't think so, Howard. I think we've been through a lot, and I think we've touched base on almost everything that we were going to talk about as well, which has been fantastic.
All right. Well, on Dental Town, we have 50 categories: root canals, fillings, crowns, all that. One of them is the international form, and it lists all 212 countries. And the most popular one is the United Kingdom, and the second is Australia. We have, before this show, I checked to see how many. We have 4,617 registered dentists on Dental Town from Australia. I think 400 from New Zealand. But I just want to tell you, love your country. Sydney is the greatest country. When I come down and see my brother Paul, we'll have to go get a beer or something. I don't know.
Definitely.
And ride in a tunnel to see what America's going to look like after Elon Musk gets done with this. But thank you so much for coming on the show, and I hope next time I see you, we're drinking a beer in Sydney.
I look forward to it, Howard. Thank you very much for having me.